you ready?
I think so. We're 6:30. What?
All right.
You guys ready? All right. You want to talk about some food?
We get to see pictures.
Oh yeah. Don't you worry. There'll be pictures. Good thing you didn't have glasses about it.
Don't forget to turn your button on.
Do you want the main light off?
Yeah, probably. We might turn the stall on a little bit.
Yeah, maybe. You guys gotta give me 1 second. It's really hard to do 2 screens when you like can really only see one. Do you see that sound switch over there? Come back over. And I sort of had this set up earlier, and then somehow it all went away.
Want me to turn on some music to keep everybody going?
No, we're good. We're good. I can entertain, I can sing, I can dance. Not well, but I can. All right, can you hear me now?
Yes.
Okay. I might be a little bit of a Trekkie, so if you guys don't know who the Borg are, we can explain later. But the most important thing to know about the Borg is that resistance is futile and you will be assimilated. So tonight we're going to talk about why resistance isn't futile and the humans are smarter and we're going to win. Except that first I have to go over here and tell it I'm talking to this screen. Oops. So how we got here, parasites and their love of our drugs. Many of you may be aware that parasites love the drugs that we give them to kill them. That's kind of a problem. You've heard about antibiotic resistance and all of the bacteria that the hospitals have created. We also have that same issue in parasites. And here's how we got there. This is the good old days. I don't remember this. It was pre my time. But you used to have to tube deworm every horse. So you'd put a tube down them. And the drugs that were given were a horrible combination of organophosphates and other fun toxic things that you couldn't give orally because it would burn the mucosa out of the inside of the horse's mouth. So you had to use a tube. There were veterinarians who died from blowing their tube out after tube deworming and giving themselves organophosphate toxicity. So we were all very excited as a profession when Zymectrin became available. Zymectrin was the first ivermectin that was available over the counter for you guys to give to horses. The problem was that we were all so excited to have it that every time the farrier showed up, we gave it. Because, you know, the more the better. That's how humans operate. So that was the 80s. In the 90s, we were like, oh, we shouldn't give the same drug all the time, so we're going to rotate. Because rotation sounds great, right? Then you're not showing them the same drug. You're going to use Panicure one time the farrier comes, and then you're going to switch to Zymectrin, and then you're going to switch to Strongyne, and all the boxes look different, so the parasites won't know what they are when they come hit them. And this is a really, really, really good idea. And it is a good idea. It just doesn't work. So we get to the zeros or whatever we're calling them. And we do the same thing, right? We're like, we're still going to rotate. But now, sometimes we're going to do this too. We're going to hit them for 5 days with a double dose of Panicure, and they're not going to know what hit them. And we're not going to have any more parasites. But here's what really happened. We said to the parasites, we're going to show you every drug in our arsenal, and we're going to show it to you a lot. And the parasites said, keep it coming. We're going to use all of that information you're throwing at us, and we're going to learn how to beat you humans. And so what we've created is a population of parasites that know how to handle every drug we have. Here's the even worse news in case that's not scary enough. There are no new drugs in the pipeline. None. The companies that develop these, not sure why, I'll find you a rep if you want me to, but they are not even researching these drugs, which means that if tomorrow our drugs quit working completely against all parasites out there, the soonest we would have a new drug is 10 years from now. So that's terrifying. And for those of us that aren't old enough to remember, large strongyles in particular, which we don't have as an issue anymore, we'll get into that a little bit later, but large strongyles used to cause absolutely 110% fatal colic in horses. We don't see that anymore. I've never seen one in my life. And Dr. Ferguson probably never will unless resistance becomes a huge issue, and our future baby veterinarians back there probably won't see it either unless we lose all of our drug classes and large strongyles learn how to deal with them. So that's why this is terrifying for us. Here's the current situation, and you don't have to memorize this table, I'm going to tell you what it says. But the three biggies that we worry about in horses are small strongyles, the large strongyles we just talked about, and ascarids. Large strongyles, luckily, for reasons that we're going to talk about a little later, have a very long life cycle. The good news is that makes you easy to kill. If you have a long life cycle, you're a lot easier to kill. So they are not resistant to any of our drugs. That's good at the moment. However, small strongyles, there is reported resistance to ivermectin and moxidectin. It's not widespread, but we've absolutely seen it. It's been seen in Kentucky, it's been seen in Central Europe, and it's been seen in a couple places in Asia. You may as well give them candy as opposed to giving them Panacur or Anthalcide. Small strongyles eat that for dinner. And Strongid, again, may as well not give it, that's Pyrantel. Ascarids, luckily, are the opposite, and we're going to tell you why that's in our favor. There is widespread resistance to ivermectin and ascarids. Like, they eat that for dinner. They eat the ivermectin and the moxidectin. And moxidectin is the brand name Quest. So those drugs do not work against ascarids in this country. We're showing some resistance to fenbendazole, which is Panacur. We have probably done that with our very aggressive Panacur power packs. For a while, it was recommended that if you wanted to be sure that a foal did not have ascarids when they came into your farm, you did a Panacur power pack on them, and that would clean them out. What it probably really did was showed the ascarids a really nice long dose of Panacur so they could really absorb it, soak it in, learn how to deal with it. Oxybendazole, which is Anthalcide, luckily, ascarids don't like. And we're showing some resistance to Strongid. So we have to be really careful. Fenbendazole and oxybendazole, they're in that same kind of big bar there because they're first cousins. And if there's resistance to one, there's soon to be resistance to the other because they're so closely related. This is the next scary thing. I would like to point out Martin Nielsen down there, the gentleman's name. He does the most amazing parasite research out of Kentucky, and every once in a while he uses GoFundMe to fund his next research project, and we aggressively supported him last time, and I promise you that we will post if he does again, but the man does amazing, very practical research. So this is him looking at what are called egg reappearance periods, and that is when you deworm. Let's say your horse has a lot of parasites, you deworm, the parasites go away, they die. They're going to die for a certain amount of time, and that's what's called the egg reappearance period. So when Panacur first came out, that took 6 weeks. So you'd kill all the bugs, and you wouldn't see eggs for 6 weeks. Now it's less than 2 weeks. And what that's telling us, again, is that the bugs are just learning. They're learning how to deal with what we're throwing at them. Strongid used to be 5 to 6, now it's 2 to 4. And these are in horses that don't show straight up resistance. So these are horses where we're calling the drug still effective, but we're getting these lowering. And that's what's showing us that they're learning, much like the Borg. Ivermectin used to be 9 to 13 weeks, and now it's 3 to 4. And I have to say moxidectin is the scariest one for me, because moxidectin is, for me, that's the new drug. Like, we haven't had it around very long at all. And when it came out, you were supposed to be able to deworm with this thing like 3 times a year, and boom, everything was covered, because it went 16 to 22 weeks before you saw parasites again. And now we're seeing parasites in 4 to 5 weeks. 4 to 5 from 16 to 22. Like, I saw that number and I was terrified. So, we're going to talk, Dr. Ferguson is going to talk about treatment. I'm going to talk a little bit about, you've seen kind of why we're scared, how the resistance is, and now I'm going to talk a little bit about how parasites live and how we're going to use that information to take them out at their knees. And that's, like I said, what Dr. Ferguson is going to cover. So pretty much every parasite we have of horses works this way in one way or another. If you were able to go out with a microscope and look at your grass in the morning, that pretty dew, I don't know if you guys can see it, but it would have little strongyles in it. Yay! And those strongyles are then eaten by the horse. They go into the gut. That's where they turn into bigger strongyles. Some of them go into the wall and hibernate. Some of them hang out in the lumen and turn into adults. Then those adults have babies, and they send their babies out into the world in the poop. That's what MJ is checking right now on you guys that brought in poop samples. She is looking for, those are eggs over there on the left-hand side, and she's back there right now seeing how many of those eggs we have. For small strongyles, this happens in about 4 to 6 weeks. For large strongyles, that takes about 8 months, and that's why it takes us a long time to kill them. It's easy to kill them because they take so long. And for tapeworms, so those are kind of the big 3 that we deal with our dewormers. For tapeworms, they have a mite that's sort of involved there, so you would see a mite on the grass that has strongyles in it, or tapeworms in it. Again, it's a really long process. It takes tapeworms about a year. The other nice thing about all of our parasites is that they tend to have a 1-year lifespan themselves. So they don't get very old. When they get to about a year, they die off. So we're going to take advantage of that with some of our strategies. So we know we have resistance, and we know the life cycle of parasites. So the question is, now, what are we going to do about it?
Can everybody hear me? Okay. All right. Where were you pressing it?
Down arrow.
Okay. So how are we going to fix the mess we're in now? Well, there are a few suggestions. Laser beam. Using this time machine. Well, that's a great idea, Dr. Evil. If we could go back into the 80s and tell people to slow down on the use of Zymectrin and not deworm every time the farrier comes, that would work great, but unfortunately, that hasn't been developed yet. Liquid hot magma. That might do it. Or sharks with laser beams on their heads. Well, in lieu of those options, what we would suggest is deworm once a year, one time in the fall, and we suggest you use Equimax. That's a combination of ivermectin and praziquantel. Ivermectin for your small strongyles that are a problem, and praziquantel gets those tapeworms. Tapeworms don't show up on your fecals, so we're just going to go ahead and deworm for them once a year, assuming they may be there. We don't recommend Zymectrin Gold because there are reported facial swellings in horses pretty commonly, so don't recommend that product. Same exact ingredients, but for that reason we prefer the Equimax. So, is everybody on board with that plan? You're going to deworm one time per year, not 12, not 6, not 4, 3. Now, the exception is if you bring us a fecal sample in the spring and your horse is reported to be a high shedder, you may deworm twice a year. You may deworm in the spring with plain ivermectin, and then in the fall with your Equimax, like we talked about. So what's a high shedder? So when we do those fecal egg counts, which Mally is working on inside, we are going to come up with a number called EPG, that's eggs per gram. So how many of those little larvae's eggs do we see in 1 gram of your horse's poop? Anything less than 250 eggs per gram is considered a low shedder. Those are not the problem horses that are spreading parasites on your property. Even 250 to 500 is only considered a moderate shedder. We don't consider them a high shedder until they're up in the 500s or greater, which we very, very rarely see. You can ask the girls, most of their fecals are totally boring. They count for hours and everybody's 0. So there's no point in deworming if your horse has 0 eggs there. You're just contributing to that resistance problem. And actually, fun fact, 20% of horses carry 80% of the worm burden. So that other 80%, you're probably going to get those 0 fecal egg counts, or at least less than 250. They're low shedders. They're not spreading parasites on your farm. You don't have to worry about them. What we do with our fecal egg counts is we have to identify who those high shedders are, so we can tell you specifically that horse needs to be dewormed in the spring and the fall. Okay, so why spring and fall? There's a lot of tiny writing up here. It's from the AEP's Parasite Control Guidelines, which you can look up online. They're very helpful if you want a bunch more information on this topic. But essentially it says parasites don't like it when it's greater than 104 degrees Fahrenheit. Well, even on our hottest days here, it's probably not greater than 104. It is optimal between 77 and 91 degrees. Well, that's almost every day in Florida. Not today, but almost every day. Certainly every day here during the moderate spring and summer times of year. And even 50 to 77 degrees Fahrenheit, the parasites like that pretty well too. Within 2 to 3 weeks they're hatching. So we want to hit the parasites when they're hatching. So the optimal time for that is going to be spring and fall. And that's just because we live in Florida. So January it's hot, February it's hot, March it's hot, April it's hot, May it's really hot, June it feels like you're on the sun, July like you're wrapped in a tin foil on the sun, August like you're covered in baby oil wrapped in tin foil on the sun, September it's really hot, October it's hot, November it's hot, December it's hot. And at some point in that time period, apparently Florida picked today, you may decide that it's winter for 3 to 7 days at a time. So no point in deworming during those few days of winter, because that's when the eggs are kind of hibernating. And no point deworming in the middle of the summer when your eggs are baking out in the 104 degree heat and dying off. So we're going to hit them in the spring and the fall when they're hatching and spreading to your horses. Okay, so I told you there's an exception. You get to deworm in the spring if your horse is a high shedder. The other exception is babies. They are completely different animals. They have completely different levels of protection against parasites. They haven't developed their own immunity against the parasites yet, and they're susceptible to completely different parasites. So we're going to give them a deworming protocol that's a little bit different. You're going to deworm your babies once at 2 to 3 months with Panicure. Just go ahead and do that. We don't have to do a fecal. We are going to go ahead and assume they have roundworms because babies usually do. That's a perfect time to hit them just as those roundworms, the ascarids, are starting to climb in numbers. And if we hit them early, hopefully they will not be a problem later on. Then what we'd like you to do is bring us a fecal sample from your baby at 5 to 6 months. And that's so we can determine which product to use next. If the roundworms are still a problem, if we didn't get all of them at that first deworming, we're going to give you another product for roundworms, and that would be Strongid, which is your pyrantel. Note it's not the same product as the Panicure, because just giving that Panicure once those roundworms are already going to be resistant to it. So if we tried to use the Panda Cure again, it would essentially be ineffective against those roundworms. That's how quickly resistance develops within your horses and on your farm. If they're fine on the roundworms and they have a high strongjaw count, then we're going to just do a plain ivermectin at that age. And if they have nothing, then we just don't deworm them, because no point in deworming a horse with a 0 fecal egg count. Then we want to check them again at 9 months, because by then your roundworm risk is pretty much gone as long as you followed our protocol. They've developed their own immunity, so roundworms shouldn't be a problem. But what you do have is you have that strongyle population climbing. Those small strongyles that we worry about starting now at 1 year of age and continuing for the rest of the horse's life. So if they do have a high fecal egg count at 9 months, we're going to hit them with ivermectin again. And then starting at 1 year, we're going to give that Equimax. Again, we can just go ahead and give it. We want to hit any tapeworms they may have that didn't show up on a fecal, and we want to take care of any strongyles they may have developed during that first year of life. So the Panda Cure as a baby is a definite. The Equimax at 1 year of age is a definite. In between, we'll go by their fecals, so just bring them to us and we'll tell you what to do. Okay, they're still special until they're 3 years old. 1 year olds, 2 year olds, and 3 year olds get to be dewormed up to 3 times a year. Okay, so just like your grown-ups, we're gonna do ivermectin in the spring, Equimax in the fall, and then in the summer, bring us a fecal to check, and if they're high at that time, we'll let you throw in a 3rd one in there. Again, because they're still developing their immunity against these parasites, and they're a little more susceptible. What else can I do? You can get out your handy-dandy pitchfork and clean up your pastures if you want. It is kind of a pain in the butt. It's a messy job. But studies have shown that if you pick up the manure on your fields, you do decrease your worm burden in your horses, because that's how it's transmitted. As Dr. Lasher talked about, horse poops out the eggs grow into larvae, horse eats the larvae on the grass, and then gets infected. So if you clean up that poop, it can't spread. Another thing not to do is you don't want to take that fresh manure that you picked up and spread it on your fields where you have grazing horses. You should have some sort of composting system, either at your property or you have your manure taken off somewhere, however you want to do it, but you want that manure, the fresh manure you want to sit and compost, and you don't want to spread it until it's composted. During that composting process, the internal temperatures get high enough above that 104 degrees where it kills off the parasites. So it's okay to spread composted manure, but you don't want to spread fresh manure back on your pastures where horses are grazing. That's a really good way to spread the parasites all around. All right. So I know that was kind of a lot of information really fast. Yes, Andrea?
Donkeys?
Oh, donkeys count as horses.
Okay.
Yeah.
I'm gonna go see where she's at on fecal, so that maybe we can go over you guys.
Want to hit the light?
Yeah, and I'll hit the light too.
Yeah, same rules for donkeys. Babies, we're going to deworm more frequently, and then adults we're going to only do once a year in the fall, unless we give you special permission to do more often. I will tell you, just as an FYI, I did see a parasite for the first time this past year I'd never seen before. It was in a donkey foal. It was Strongyloides westeri. Does anybody know where that parasite comes from?
Probably west.
Good guess. It's transmitted from the mare's milk to foals, and that's the only time you see it. So this was a baby donkey. I want to say he was like 4 months old. Anyway.
You know it was adorable.
Yeah, super cute and fluffy. Yeah, 4-month-old baby donkey. And I was like, oh, you're perfect. Oh, you're loaded with parasites. So that is one of the reasons that we want to deworm the babies a little more often.
So why did it go through her milk? She had such a high load.
So they are still researching that. It has not been proven that deworming the mare prevents transmission of parasites into the to the foal. But it's a thought, it's a consideration. If you want to deworm your mare right after foaling to prevent that transmission in the milk, I think it's a reasonable idea to do so. And we weren't sure the situation of the donkey's dam. They had kind of rescued the baby. It was kind of malnourished, so I assume the mare did have a high worm burden. Yeah. Yes.
So then, the practice of dragging your pastures or just mowing and breaking up the manure is not good?
Well, along with the theory of if you can spread it out thin enough that it's lying out flat, and it's the middle of the summer, and that ground is going to get above 104 degrees, you can kill the larvae. But if that's not happening, if it's not the middle of the summer, it's probably not working to kill the parasites. You're probably just spreading them.
For instance, if you drug your pastures today and you had a high egg count, which I can tell you don't,
But she has secret information.
you would be spreading parasites across your field, unfortunately. And that's where it's tough. You know, like right now at my house, it's kind of killing us a little bit because around the hay feeders, there's a lot of manure. So I either have to go out and pick it up, which I can be honest with you is not going to happen, or we basically wait until it's warm enough out, then we rotate off that pasture, drag that pasture, give it 7 to 10 days, and then put the horses back on there. That's why rotation is really important, which is a shameless promotion for our next seminar on parasite management, where she'll talk a little bit about pasture rotation. So, MJ is finishing up on the fecals that you guys brought. I'm going to go over just a few from this week because you guys are really boring, I'm going to be honest. I think all of them. I didn't get the last two.
Very low.
Yeah, everybody's boring. So,
I told you.
this week, I may pick on you just a little bit, Cynthia, if that's okay. Cynthia has 2 horses that live at her house, and we did fecals on her horses earlier this week. And this is the importance of fecals. So she has one, Bella's 22, 23? 24. Yeesh. Not sure when that happened. Bella's 24, and Truffles is 10-ish? 12? So Truffles is 12. He's an easy keeper. He is fat. He's shiny. He's all of those things. Bella is 24. She's relatively fat. She's a picky eater. She's a pretty easy keeper, but she's also a picky eater, so she's a little bit tougher. Which one do you think has the high egg count? The fat and shiny one, right? So if you were just looking at them, you were saying, I love when they come in and they're like, oh, their hair coat, I'm going to deworm them because they've got worms. I'm going to tell you they don't have worms. Because Bella is 0. Like, she's not just low, she's 0. And Truffles is greater than 250. He had 275.
That's why I didn't get.
That's why you hadn't gotten your thing yet. She hadn't gotten her results yet.
Why didn't I get a 14?
We
And
were
if
making you
you
wait.
picked those 2 horses, you would never guess that the fatter, shinier, you know, sort of healthier, and I don't, Bella just has a little bit of an older horse look to her. The fatter, shinier one is the one that's shedding all the parasites on there. And the other one, so what that means is that Bella has great immunity, and T just doesn't. So, here we go. What do we have over there?
No moderate or high shudders. Everybody is less than 250.
There you go.
Everybody's less than 200. The highest one on here is 120, which we would still not recommend doing an extra deworming on.
May.
What's
We'll have
that?
to look up May. Did you
Yeah,
bring
sorry.
Poop?
Did you bring poop today?
She was a high shedder. May was.
May was a high shedder?
Yes.
Okay, so May is one of those that we would deworm. We would give her an extra one, basically. So she would get dewormed with like ivermectin now, and then in the fall we would hit her with Equimax. You may have noticed that we didn't mention a thing about Quest. I don't know if anybody's asked that question yet. But the reason we didn't talk about Quest is we tried very hard to keep Quest in our back pocket for cases where we think we need to use it. And so we try to be a very good steward of our use of Quest and only give it to those horses where for some reason we've decided that horse needs it. The other trick to Quest is it can be in tiny horses, like your minis, the small ponies. You want to be really careful because you can easily overdose Quest. For even Peanut, who's tiny, just by her name, you know, she's tiny. She could get a whole tube of ivermectin accidentally. Not recommending that, but accidentally, and she'd be fine. She might have some mild side effects for 24 hours. If she got a whole tube of Quest, we'd be sending you into the vet school for her to go on a ventilator. So that's the difference.
Yeah. We're just asking you nicely to please not use Quest.
Yeah.
Yes, Kathy.
So now, I have a couple of larger horses.
Mm-hmm.
Your advice on worming my giants?
Dose by weight. So almost all of your tubes are going to be have weight measurements on them.
Right.
And usually a tube goes up to 1250. So if they weigh more than 1250, you probably need like 1 1/4 tube or whatever it is to get up to that weight.
1800.
And then we've got 1,800 and 2,000 pounds.
Yeah. Yeah. So you have to
You need 2 tubes.
add them together until you get to the right weight. Yeah. No point in giving more at any given time, you know. But so you probably could pretty safely do.
Horses can't possibly be that big.
I think they could be.
Yeah. I believe it.
We'll put a tape measure
Do you
on
have
it.
one of our super accurate weight tapes from Neutrina?
I don't know that we could get our super accurate weight tapes
You
around
think it would
those
be
two
too big?
girls. I think we'd have to go with
Actually,
the longer
the front to
tape.
back wouldn't happen, yeah.
Yeah.
If you pasted them together, taped them together, yeah.
Develops
Yeah.
really bad mental image though, and that's not picture one thing.
We'd have to go with like the 100-foot tape, you know?
Yeah.
Yeah. So sorry, Andrew.
Two questions. First of all, when they have the dosage by weight, do they assume some of it's gonna get spit out? Cause I've never been able to give it to them, get it all together. Or do I have to like plan on an extra quarter of the tube because I know Luke is gonna spit some of it out no matter what I do?
Oh my gosh, that's
I would plan on extra.
Okay. And what if you're sending your horse like out for training or he's gonna be in a different pasture, do you have to have a different fecal done?
We recommend that they have a fecal done when they come home,
Okay.
so that we know,
Picked up anything?
see if they picked up anything. Yeah. So the interesting thing on, let's see, who do we have here? I can't read that.
Do you need my glasses?
You want me to hold it?
No, it's not that. It's MJ's bad writing. I'm not sure who this is. Where did we lose MJ? Somebody had an asker it. I'll find out who.
Oh, that was me?
Yeah. I can't read your writing. Who's this?
Who had that Ascarid?
I was working fast.
And we appreciate it. Everybody give a big round of applause to MJ for running Beagles. Molly. Okay, Molly had 1 asteroid. So that means,
Pop quiz. Are we gonna deworm
yeah.
Molly?
Are we going to deworm Molly for asteroids? No.
Good.
But she's spreading them to foals. Any foals that would be born on that farm, that's where they're getting them from. So as an adult, her immune system is handling the ascarids, but she's probably got 1 in there laying a couple eggs here and there. So the foals are going to pick them up from Molly. So that's why we need to keep track of our foals. Selena had 120. So that's a horse that we want to keep an eye on. You know, we want to know when that horse was dewormed last. If it was 2 weeks ago, obviously we have a problem. But if it was 6 months ago, not so much. Those are just those horses that we go, you know, normally we're somewhere in the 50 range, 120. That's when we definitely want to run fecals on a regular basis. Noelle was 0. Spot had a whopping 5. Does that say Charlie or Farley? I can't see. Farley. Farley had 4. And Mr. had 0. So even if you drug your pastures today, you weren't spreading parasites.
Oh, there you
Yeah.
go.
Yeah. So good job, guys.
Yes.
So I only brought his, but I have 3 horses. Should I assume that they're okay? I
You
mean,
can't
can't
assume
do
anything.
no?
Yeah.
Yeah,
You don't
unfortunately, it's
say
an
about
individual
assuming.
thing. I mean, because
Like we showed.
Tuffy and Bella has 2 horses that live together, do everything together. One's shiny and fat, the other one's not as shiny and fat, and one's a high shedder, one's a low shedder.
And I had the same situation at my house. I had 4 half siblings on the same property, and the easiest keeper of the 4 half siblings still holds the record for highest number of eggs we've ever counted here. It was 1,832. Yeah. Not me. had to get chocolate for it.
We have some patient texts.
Yeah. And you know, his three half sisters were all 0 at the exact same time and with the exact same deworming protocol. So, you know, unfortunately, we want to make it easy and say like, oh, well, Mr. 0, so everyone's 0. But unfortunately, we just can't. And that one of the other things that we didn't necessarily talk about tonight was how you identify resistance on your farm. And one of the reasons we didn't is because oftentimes we don't have the number of horses in a population to truly identify it. The way that Dr. Nielsen identifies it on the farms in Kentucky is he goes in and he deworms 150 horses, and then he does fecal egg counts on them 6 weeks later. If he's got high ones that are starting to reappear, he'll pull those and say, okay, can I give that drug again and get that number to go down, or can't I? And for us, to be honest, you know, most of us have 2 or 3 or 4 horses. I can't find 6 high shudders on a farm, no matter how hard I try. We just don't have the population. So for us, it's more about identifying those high shudders we catch every once in a while and being good stewards of the drugs on those horses.
What if you got like 8 head
8
on 40 acres?
head on 40 acres, you're probably doing all right. You know, like those, one of the ways that you'll get high numbers is not just that you've got ones that aren't resistant to it naturally, you'll have too many in one small place. So from that standpoint, they're not picking up, you know, that same grass all the time, a lot of times. But those guys, you know, still those 8, we say we should start with some fecal egg counts and see what we got. But you'll probably find that 1 or 2 of them might have some shedding, and the rest of them won't.
So if a horse was on a dry lot, would there be less chance of picking up?
There is less chance because the parasites don't like all that sand. Not necessarily, you know, if they get into, like let's say there's they get into the hay, you know, they can pick it up that way, but the parasites don't love that sand. Flies don't either, just for the record. So, there we go. All right, yeah.
Just for fun, what about organic wormers?
Oh, so the second highest count we've ever had.
Can you repeat the question for the camera?
What about organic dewormers? The second highest fecal egg count we've ever had, besides my horse, was a donkey that was being dewormed with diatomaceous earth and nicotine. And her count, I don't know how high she went, because I believe that the technician said, I have counted to 1,600, can I please stop? And I said yes. Yeah. And we lost her the next day. So the parasites, she had so many parasites that we lost her. And we don't lose horses to parasitism anymore. Like that just doesn't happen.
It's a good thing.
So she was probably an animal who did not have a good resistance naturally to parasites. And then on top of that, this is how she was getting dewormed. So the drugs are important to use. I think it's hard to argue with giving ivermectin to a horse once a year. You know, I can't get much more natural than that. That's using chemistry in our favor, not against us. So diatomaceous earth, though, does not work. Put it in your garden, not in your horse.
I mean, just so you guys are educated on the topic, it's based on a completely unproven theory that the worms are going to eat the dirt, and because the dirt is sharp, it's going to cut up their insides and kill them. What's that?
But the thought would be it wouldn't cut the inside of the horse, but it would kill the inside of the horse.
Yeah, it just doesn't work.
Also, worms live in dirt.
Right. Yeah. Yeah. But you can tell that to the next person that tells you to deworm with diatomaceous earth. And we need you guys to help too, to spread the word when you run into people that are still doing rotational deworming every month or two. They're hurting your horses ultimately because they are contributing to the resistance problem in the United States of America / the world. So educate them, say you came to Spring Hill Equine and they told you to only deworm once a year, and if they have a problem with that, they can call us.
Exactly. There we go. And we'll be around to answer any of you guys' questions, and we will give you, oh, sorry, go ahead.
Just an FYI, my horse, for the past 3 years, I've only wormed once a year.
Okay.
So she said for the past 3 years she's only dewormed once a year, so gold star. Was that metric? Perfect.
Appropriately dewormed. Very good.
Yeah. So gold star.
In the fall,
Perfect.
Very good. Love it.
Yeah.
and she was a 0.
Very good.
Perfect.
Every time I've fecally tested my horse, he's been 0. Yeah.
There we go. So thank you guys for coming out tonight. And again, we'll be around with any questions you guys have once we're done. Okay. All right.